Good morning, everyone. Happy Thursday. It is November 3rd today, and it is exactly 1 month since I started my private practice. And I wanted to come on to just give you a quick update about how things are going. My brain, my mind, my soul are just exploding. It's been an amazing first month, and my mission and goal for starting this practice is to elevate women's healthcare to a level that is currently not available in traditional private practice or traditional medical settings. And what do I mean by that? So have you ever called a doctor's office and you have been on hold for 10 minutes, 15 minutes, and you just get so frustrated that you just hang up the phone? I know I've done that, even as a physician. And then finally, when you get an appointment, they tell you that you can't be seen for 2 or 3 months. And if you're a woman with a yeast infection, 2 to 3 months ain't cutting it. Like, you need to be seen today, right? But forget it. You often can't get an appointment, and then you end up having to go to urgent care or the ER and waste resources there and waste your money. And then finally, when you get to an appointment, the appointment's only 10 minutes long. So, you have to rush. You often feel like you're a burden to the physician. You have a very limited amount of time to ask questions. And in fact, they tell you that if you have too many questions, please make another appointment, right? And who are you really seeing? I mean, it's so confusing these days. It's an alphabet soup. There's MD, DO, PA, NP, APRN, DPM. I mean, there's just so many different degrees, and often we aren't even told when we're making an appointment, hi James, who we're actually seeing, right? And which is very frustrating as a patient. You're waiting forever to, get a surgical consult, and finally you don't even end up seeing a surgeon, right? Whoever sees you says, oh, well, now I have to refer you to the surgeon in this practice, and that's going to take another 3 months. Super frustrating. And insurance companies are another big player, right? Like, you often don't know what your bills are going to be. You get surprise bills. It's very confusing how much you're paying for your office visit versus a procedure. Then you need an ultrasound. It's all just very confusing and difficult to figure out. And if you think that it's hi Chandrika. If you think it's hard as a patient, guess what? It's no better for physicians. It's extremely frustrating for us because we went to medical school to help patients in the most thorough and empathetic manner. We did not go to medical school to, be looking at our clocks every 10 minutes and seeing patients, right? So it's extremely frustrating for everybody. And we all know that our healthcare system is broken. But that doesn't mean that we cannot that should stop us from trying to figure out other ways in which we can provide care. And that is why I started Lamorinda Gynecology Surgery, a private practice from the ground up. And a quick word about the name Lamorinda. A lot of patients or people have asked me, well, what does that mean? My practice is located in Lafayette, California, and this is a town here, and the neighboring towns are Orinda and Moraga. And so it is called Lamorinda. So that's where the name came from. I wanted to be kind of a local, homegrown practice. And so that's why it's called Lamorinda Gynecology Surgery. And my goal with this practice is really to elevate women's healthcare. It's to provide very personalized and highly accessible care. So when you come to this office, you are, you're not going to be waiting on hold to make an appointment. In fact, we don't put patients on hold in this practice. You either a live person picks up and answers your call right away, or you will get a call back within the hour. You can also text the front desk for an appointment, or if you're running late. The prices to be seen here are very transparent, and you will know exactly what you're paying. There's going to be no, surprise bills or surprise statements, surprise costs. Everything will be very upfront and transparent. And then my appointment types, patients have asked me, like, how long is an appointment? Well, it can be 20 minutes or it can be an hour, depending on what you need. So we will take care of you to the best of our ability, that day. And as far as getting an appointment, you can be seen quickly, sometimes the same day, sometimes the next day, certainly within a week or two. If you need surgery, if you're a woman with surgery, you can also be seen, quickly here. I am a surgeon. I did 2 years of minimally invasive surgical training. So chances are I can surgically fix your problem as well without being referred to other offices. So that's great for continuity of care. So our model here at Lamorinda Gynecology is very different, and I think this is something that patients are looking for. I know as a woman myself, as a busy professional woman and a mom, I don't want to wait weeks to see a physician. I want to be seen quickly in an efficient way and get my problem solved. So if that is something that is appealing to you, join me in my mission for this year, for the next year, for 2023. I want to serve 300 women in this practice, and I would love for you to help me get to that goal. And here are ways in which you can help. So if you are a patient, if you're a person, a woman in the Bay Area and you need a gynecologist, if you have a friend who is looking for a gynecologist or a family member, please refer them my way. I'm located in Lafayette, and you can check me out on my website, LamorindaGynecology.com. You don't have to write any of this down. Everything will be in the captions below. If you're a patient in California, but you're not in the Bay Area, and you still have a problem that you want to talk about, I can still see you because I'm licensed in California. So if you're in San Diego or LA, I can still do a virtual visit with you. I can prescribe medications. So that's another way to be a patient at this practice. I have a special interest in fibroids. I help women with fibroids live a life with reduced bleeding and pain and improved fertility. Thus my name, TheFibroidDoc. And so if you are suffering from fibroids and you want surgery, either surgical treatment or medical treatment, I'm happy to see you in this practice. If you are somewhere other than California, anywhere in the country or anywhere in the world, and you are looking for just some extra coaching on fibroids, what are the options available out there? Here's what I've tried in the past. What are the new technologies available? What are the new medications available? What does the latest research say about lifestyle and food and fibroids? So if you want some extra coaching on that, I also provide that, and they are just 1-hour sessions. You can email TheFibroidDoc@gmail.com for more information on that. I am starting a menopause mastery course in January. So for women who are, experiencing hot flashes and night sweats and trouble sleeping and trouble focusing and trouble functioning in your daily life, and you want to learn more about menopause, possible treatments, maybe some hormone therapy, menopausal hormone therapy. So if that's you, join me for my menopause mastery course that is going to be starting in January. They will be live sessions taught by me, followed by a personal one-on-one session by me as well. So if you're interested in that, more details to follow, but you can email me at TheFibroidDoc@gmail.com to get more info on that. If you are a woman anywhere, again, in the world, and you just want to be up to date on the latest gynecologic treatments, the new studies, what's new in women's health, sign up for my newsletter, and you can go to LamorindaGynecology.com and sign up for my newsletter there. I send out a brief email every week with more information. So check me out there. And lastly, my social media handles, TheFibroidDoc on Instagram and YouTube and Twitter. So you can follow me there. So these are ways that you can get involved and help me reach my goal of serving 300 women in 2023 at Lamorinda Gynecology and Surgery. Thank you so much for watching. Please tag a friend who could use this information. All the details that I talked about will be posted on the comments, and have a beautiful Thursday and rest of the week. Bye, everyone.